Hey guys, so in today's video, I wanted to share some tips for getting into the medical field, like if you have never had a healthcare job before. And again, I am using an article, well, it's actually a blog post, to kind of run my thoughts off of. I find that I'm a little bit not as rambly when I do that. And if you're curious about my own personal experiences, I will kind of talk a little bit about that as well, but I can make another video going more in depth into my own personal experiences getting started in the medical field if that's something that you would prefer as well. So, tip number one would be to find a mentor. Now, that could be somebody who went to your school if you're in high school, or somebody that you know that works in the field that you want to get into, whether it's a CNA or, whether you want to be a phlebotomist or a lab technician or something like that. Whatever the case may be, look for someone who already has experience, who is working in the field that you want to get into, and let them know that you would like to, or ask them if they would be willing to be your mentor. There may be like different ways, like if you're a high school student, there may be different ways that you could get into like a job shadowing program. I know at my high school we had what was called cadet, which is basically you get to go and experience a certain job and you go there for that period of time that you would be in cadet, or your job shadowing or job training program. So you could attend networking events to find a mentor, or like professional association meetings, whether you're trying to be a nurse and they have like for example, I live in Indiana, so they have like an Indiana Nursing Association. I don't even know if that exists, but Indiana Nursing Association meeting, and you may go and find a mentor there. So number two is get used to being scared. I wouldn't necessarily say being scared, but just kind of dealing with emergency situations. If you're getting into the medical field, kind of gross or gory type things, because even if you don't end up working in a specialty or in an area of practice where you are constantly seeing like emergency, like say you don't work in the ER or you don't work in an urgent care, you are still going to see gross things. Even if you work as a CNA, you're going to deal with feces, urine, vomit, blood, wounds, drainage, all that kind of stuff. So get used to kind of seeing those types of things and not being as grossed out about it. I know, like, when I first got into being a CNA, I had a hard time, like, with the smells, um, because wounds are some of the worst things that you can smell. C. diff is awful, and I had a hard time like keeping a straight face about it. I think one of the biggest things as far as like tips that I would give you is don't be afraid to um, make a mistake, because everybody makes mistakes, and it's how you respond when you make a mistake that really matters. It's not about the fact that you made a mistake, it's how you respond to the fact that you made a mistake and what you do after making the mistake. Once you get into the healthcare field, you will, get used to everything, but it's good to kind of like um I don't know how I would say it, like kind of get used to certain things, or expose yourself to dealing with certain things or seeing certain things, smelling certain things, because the medical field it can be very nasty. Number three is to ask questions, especially if you're in high school and you have the ability to ask somebody, like if you are in a job shadowing program or things like that, ask questions. Don't be afraid to ask questions when you're in nursing school or if you're trying to become a CNA. Ask questions. There is no stupid question. The only stupid question is one that doesn't get asked. And I used to be somebody who was constantly afraid of asking questions, and it does you no good, because you cannot be sure that somebody in the class other than you is going to ask the question. So if you have a question, don't be afraid of what other people will think of your question. Just ask it, because then at least you'll get the information that you're looking for. Um, and I will say that if you're looking to get into the medical field, something that is good is to ask questions, because the medical field is constantly changing. Like, There could be something that is the best treatment today, and next week there's a brand new treatment that works even better. So when you're in the medical field, you have to constantly be learning new things. You have to constantly be on the lookout for new treatments, new developments, new research, new technology. The list is on and on. Number 4 is don't ever pretend to know something, because you're only going to make yourself look stupid. Not just that, but um, you need to, understand that, like I said, the medical field is constantly changing. And the more that you own up to the fact that you don't know something, nobody's going to look at you like you're dumb if you say, "Hey, I don't know how to do this. Can you show me how?" Because once you do it and once somebody shows you and teaches you, you should be able to then go on and use that skill in your everyday practice. Not everybody's going to know everything. Even the biggest doctor or the best surgeon who's been doing it for years doesn't know everything because, like I said, there's constantly changes, there's constantly new research and new technologies. So it's good to, you know, admit that you don't know something. It's better to say, "Hey, I'm not comfortable performing this procedure." Like for me, as a medical assistant, I wouldn't be comfortable performing certain procedures that I've never done before unless I'm actually shown how to do those things. Obviously, I can't do an IV unless I'm trained in how to do an IV, so don't pretend that you know, because you could actually hurt somebody or hurt yourself or cause like some sort of incident where then your license could be on the line. It's better to just admit that you don't know everything, um, and move on from there. Number 5 is grow thick skin. I definitely agree with this. You cannot, in the medical field, you cannot take things personally. People are sick, people don't feel good, especially if you work as a CNA in memory care. Don't take things personally, please, because these people, they don't know what they say sometimes. And like I said, people are upset, they're scared, they're in pain, they're lonely. You never know what is going on in their body that may cause them to react to something in the wrong way, and it has nothing to do with you. Or like in memory care, they could think that you're somebody else, and so they're taking out their anger on you because they think that you are their daughter or their son or whoever who made them angry in the past, and they're taking it out on you, but it has nothing to do with you. I will say that as you continue to work in the medical field, you will eventually develop a thick skin. You'll understand what I'm talking about. When I first became a CNA, I was very sensitive to certain things, and I am just totally not anymore. You get exposed to so much so quickly in the medical field, and it just, you have to take it one day at a time. And with like comments that patients make or residents, let it go in one ear and out the other. You cannot take it personal, because that is the quickest way to get yourself like all worked up for nothing, because you can't control what other people say, how they act, how they react to certain situations. So it's better to not take it personal. Number 6 is don't back down when advocating for your patients. And I would definitely say that, this is totally correct, especially in the long term care setting. I have had to be an advocate for my patients so many times, because you see so many things. You see so many people who get mistreated, whether it's by nursing home staff or like agency staff. I have seen, when I was in nursing school, I had to report my clinical site or someone at my clinical site, to the State Board of Nursing because of the way that they were treating some of the residents. It was a select group of CNAs and nurses that were mistreating certain residents by force feeding them. And I did end up reporting them to the State Board of Nursing because I could not, in my conscience, I could not be okay with not saying something and not speaking up for them. I have done so many things to advocate for somebody. Like, if I have to go up to the nurse 12 times to say, "Hey, this person is in pain," even if they don't, like, if the nurse isn't going to go and provide them with medication, I'm going to go to a different nurse. even though that might make me look like a shitty person as a CNA, I will always do what I feel is right for my patients, and I cannot stand when people are mistreated. You may say that that makes me a horrible person. You may say that that makes me a bad CNA because I'm going, like, not going with the chain of command, so to speak, but there's only so much that I can do. And I will always, like, if my patient can't speak for themselves or my residents can't speak up for themselves, I will be that voice for them because I care about these people. You know, they're my responsibility for my shift, but I personally can't even ignore the fact that they're not being heard. I can't let them just go on not being treated right. And, you know, it's too much. You will see this if you work as a CNA in the nursing home. You will see this if you work as a nurse in a nursing home. Even if you work in dietary, you will see it. And it's just important that you speak up, especially if you see somebody mistreating them. If you hear somebody talking to someone the wrong way, speak up. Um, so, yeah, if you work in a place where, you know, you are speaking up for somebody and you're getting in trouble for that, or if you are reporting something that you saw and nobody's listening to you, it might be time to find a new employer. And honestly, given whatever situation it is, it may be time to report that facility to the state. You cannot be retaliated against for doing that, and it will be anonymous. Um, so, anyways, I'm going to split this into two different parts because I still have advice, but this is almost 12 minutes long already, so I am going to stop the video here, and tomorrow I will upload the second half of this video for you guys. So please stay tuned for that, and I will talk to you guys in my next video.